Hi, welcome to Future Nurse YouTube channel. Please subscribe and support our YouTube channel. So let's start today's video. So the first question is low Apgar scores 1 and 5 minutes are reliable markers for. So scores 1 and 5. The answer is need for resuscitation for newborn. So low Apgar scores 1 and 5 minutes are reliable markers for need for resuscitation for newborns. So next question. This is not an indication of amniocentesis. So correct option is at 8 weeks of gestation for chromosomal study. So this is not the indication for amniocentesis. So coming to next question. The following is the best method for performing a physical examination on a toddler. The following is the best method for performing a physical examination on a toddler. Answer is from least to most intrusive. From least to most intrusive. So coming to next questions. A primary power of lower dash uterine contraction. So next, the following would be inappropriate when administering chemotherapy to a child. So inappropriate is observing the child for 10 minutes to note for signs of anaphylaxis is the inappropriate when administering chemotherapy. So next question. Fear of height. So this is the direct question. Fear of height is called as acrophobia. So in the same way, fear of water is hydrophobia. So fear of height is acrophobia. So next, the diuretic phase of burns begins. The diuretic phase of burns begins 48 to 72 hours. So next, the Health Survey and Development Committee is. So BORE committee is also called as Health Survey and Development Committee. So correct answer is BORE committee. So next, important health teaching for a patient with mitral valve replacement is. So important health teaching for a patient with mitral valve replacement is lifelong anticoagulant therapy. So the patient has to take the lifelong anticoagulant therapy. So coming to next questions. Typical symptoms of Cushing syndrome include truncal obesity, thin extremity, and moon face. So these are the typical symptoms of Cushing syndromes. So next, the normal sound elicited by percussing over the liver would be. So when you are percussing on a liver part, the normal sound you will heard is dullness. So dull sounds. So next, the best exercise the nurse should educate a patient with cystocele. The patient who is having cystocele, the best exercise is Kegel's exercise. So please remember this question. Patient with cystocele has to do Kegel's exercises. So next, the lifespan of an adult mosquito is. So this is also direct question. The lifespan of adult mosquito is 2 weeks. So next, which of the following is not a psychiatric emergency? So which of the following is not a psychiatric emergency? It's called as narcolepsy. This is not a psychiatric emergency. So next, an effective drug for filariasis. So effective drug treatment for filariasis is DEC, diethyl carbamazine, DEC. So next, birth weight of a baby doubled. So birth weight of a baby double at 6 months. So next, for instilling eardrops to an infant. So when you are instilling the eardrops to an infant, you will pull the pinna of the ear. So answer is back and downward. You need to pull the pinna back and downwards for instilling the eardrops to an infant. So next question. The absence of one or more tests from the scrotum is. The absence of one or more testes from the scrotum is cryptorchidism. So next, rabies is caused by, so this is also direct question. Rabies is caused by Lissa virus. So you all of you know that rabies is caused by Lissa virus. So next and final, ventriculoperitoneal VP shunt. Ventriculoperitoneal shunt is the surgical management of hydrocephalus. So hydrocephalus is treated by ventriculoperitoneal VP shunt. So friends, we have come to the end of the video. So please subscribe and support our Future Nurse YouTube channel for your upcoming AIIMS NORCET and also other competitive nursing officer examinations. Thank you.